Good day everyone. I am Michael, the moderator for this webinar. Welcome everyone for today's webinar, which is Workplace Violence, CMS and Joint Commission Standards. It's a great pleasure for me to introduce our presenter for today, Laura A. Dixon. Laura A. Dixon, BSJDRN, CPHRM, was COPIC's Director of Facility, Patient Safety and Risk Management and Operations from 2014 to 2020. I would now like to hand over the floor to the speaker. Over to you, Laura.
Okay, thank you very much. Well, the program we're talking about today is one that unfortunately has been making really frequent headlines. And so Joint Commission and CMS have come through and put together some standards, some expectations that they would like to see for hospitals in particular. And that's where I'm focusing on, is really the hospital. And so that's the information we're going to cover. What we're going to cover today are the CMS conditions of participation. And in a nutshell, that's what CMS said hospitals have to do if they want to participate in Medicare and Medicaid payment. Joint Commission recently did revise their workplace violence prevention standards, and they covered three main areas, and we're going to address those today. Environment of care, what is leadership's responsibility, and then human resources. I also will cover the guidelines for both OSHA, the Department of Labor, and the application on how it relates to emergency preparedness standards. And here's just some of the examples where a patient picked up a heart monitor and threw it at the provider. Patient backhanded the care worker just simply for trying to adjust the IV. Faced racial slurs while they were simply doing their rounds. And then a nurse in South Dakota was actually picked up, thrown against a wall, and bitten by the patient. So our issue is back in 2018, they found, and again, the video reiterated that, healthcare workers and even social workers are 5 times more likely to have workplace violence than any other worker. The Bureau of Labor Statistics back in 22 noted that 2.8 million non-fatal injuries and illnesses, and again, healthcare, social services had almost 450,000 of these non-fatal injuries. As far as violence from patients, we do recognize that. Yes, it is an occupational hazard. So additional impacts, well, it can lead to, as we know, psychological distress, job dissatisfaction, absenteeism, high turnover, with the average number of RNs barely lasting 5 years, barely 5 years. Higher costs. So the American Hospital Association did approach Congress to enact what they called SAVE, the Safety from Violence for Healthcare Employees. I'm going to start with the CMS Conditions of Participation. This is Centers for Medicare and Medicaid. November 22, they put out a memo, and it talked and it believed that healthcare workers, we too have a right to provide care in a safe setting. Leadership, you have to make sure that there's enough training and staffing levels so that we can provide care safely. So the regulatory obligations are at tag 144. That's actually in the patient rights section where it talks about it, where we need to identify those patients who are at risk for harm. They have to do a patient risk assessment and put together a strategy based upon that assessment. I mentioned emergency preparedness. That's Appendix Z. It used to be CMS put all of their requirements or standards or expectations in the individual manuals, but then they realized that's a lot of overlap between the manuals. So to make it easy, everything got shuttled to Appendix C. That's where you want to look. In addition, you have to provide appropriate training and education to identify those who might cause harm. So how often you do that? Well, they are expected to do it during orientation and anytime you change or update your policy or procedure. So I want to just point out some citations that CMS observed as a result of not doing this. Well, let's move on to Joint Commission now. Joint Commission defines this as an act or threat occurring at the workplace that can include any of these following. And they really expanded this definition. They put verbal, nonverbal, written or physical aggression that is deemed to be threatening, intimidating, harassment, humiliating words or actions. And again, they added additional definitions. We also have that the high incidence prompted new requirements, and that's the reason Joint Commission did some of the modification. 3 applicable standards that I'm going to go through: environment of care, human resources, and then leadership. I'm going to start with environment of care. As a hospital, you have to manage safety and security risk. We've known that, we've done that. So what are the requirements of the analysis? Proactive. Look at what's happened in the past and then start putting together your policies, your procedures, your education, your training, and maybe redesign the environment. Also under environment of care, once you have this information, look at the safety factors. Lettering in red is new, okay? So here you monitor, report, and investigate, and you have a system or a process to do so. There are 2 notes from Joint Commission on this. All incidents and issues referenced may be reported to staff in QAPI and other functions. And they also note some of these incident reports may require legal processes to be followed to preserve that confidentiality. So as far as what we're collecting, by having this process to collect the data, you can find these issues. Where are your vulnerable areas? And then put controls into place. And then we have reports and investigation. Again, the red lettering is all new. Then to human resources. Now we're off environment of care. Human resources. Staff, we know we have to participate in ongoing education and training. So what does constitute workplace violence? That's what you need to train them on. Put your violence prevention tools into play. And then finally, we have leadership's role. So they talk about directly the violence prevention program. You have such a program led by a designated individual. By identifying that person, they're accountable. Who in the organization is going to get this report? Because they did fill out an incident report. Include in your policy that definition of workplace violence. Are you going to call it a sentinel event? That's a patient safety event not primarily related to the natural course of illness or underlying condition. Another thing you might want to consider, are you going to put up any posters? All right, so let's move on to OSHA and the Department of Labor. They have guidelines for you. And in fact, OSHA put out this bulletin on it, preventing workplace violence for healthcare facilities. There are 5 core elements, what they call building blocks for this particular assessment. Strong commitment by management. It's critical to the success. What can management do? Well, look at your policies. Put them together. Post them in public areas with a clear statement on what those consequences are going to be. Do a worksite analysis. Put engineering controls. That's the number 3, hazard prevention and control. Number 4 was safety and health training. Well, who gets trained? Of course, anybody touching the patient, those direct caregivers. And of course, we have our documentation, our record keeping. I also have the OSHA guidelines. They have publications. And there's additional resources. I like this one because they have a really good self-assessment tool. And then, of course, Department of Labor, ASIS. That's the Association for Workplace Security. They have checklists that you can also download. It covers workplace violence and threat response when that does happen. So there's behaviors to be aware of, that concerning actions. I said I'd go and talk about emergency management. And I wanted to bring this up for a couple reasons, because it's not just what happens internally, but violence that occurs outside that you need to be prepared for. So emergency management standard, it doesn't mention violence itself, but you want to consider activating it if you do have to respond. So you conduct a hazard vulnerability analysis using that approach. What's the worst that could happen, and how are you going to respond? Do your safety drills. Conduct them. I do have some key takeaways with this program. Security resources, personnel, equipment, do walkarounds, identify where are your weak points. I do want to give some suggestions. Do you post more security? Do you install metal detectors? Might have helped, would have sounded an alarm. Police dogs, lock the doors when patients are present. Risk assessment, train staff on self-defense. Armed security, do you give them guns, tasers? Do you arm the staff, and anything else you would suggest? So I do have some resources here for you, about 20 or 15, 20 pages. If you have questions, I've included the email addresses for CMS. Joint Commission, they have an online question form you can fill out. Violence on the job, there's violence on the job, how long these things run. This is from CDC. Workplace, this is from June of 17. Thank you, everyone. So thank you, Michael, and I'll have it back to you to go ahead and conclude the program.
Thank you, Laura, and thank you all the participants. So that does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead. Bye-bye.